Hey guys, welcome to our Best Provider Spotlight series. My name is Dr. Wong. I'm the owner of Next Level Physiotherapy. Today I'm with my colleague, Dr. Dawn Harrell with Bearpaw Chiropractic in Humboldt, Texas. Welcome to the show, Dr. Dawn Harrell. How you doing?
Good. How are you? Thanks for having me.
Yeah, absolutely, for sure. So today I'm bringing Dr. Dawn Harrell to the show because we see a lot of patients in the clinic, and one of the most common questions we get asked all the time is, hey, what's your thoughts on chiropractors, right? So what better way to ask Dr. Dawn Harrell from Bear Chiropractic about, what chiropractic is, why she decided to be a chiropractor, and kind of get to know who she is and her clientele.
Awesome.
All right. So I guess my first question is, what made you decide to be a chiropractor, Dr. Dawn Harrell?
I'm not a spring chicken by any stretch of the imagination. I'm actually on my second life, basically. I was an athletic trainer. I worked predominantly in the secondary school setting for about 20 years. And I decided in 2016 to make a change from that, working with the students and coaches, and the stress of that and no work-life balance, to working in the industrial setting. And at that same time, I was working on my doctorate degree in athletic training. And I moved to the industrial setting, which was wildly rewarding, but I still didn't have a great work-life balance. And I wasn't actually able to use any of my skills, like my manual therapy skills that I had, that I'd learned through the doctorate program. And I was looking for other things that I could do. I was lucky enough to have met my now husband in that time frame, and I really wanted that work-life balance. I didn't want to be working late a lot of the nights, because I wanted to be home with him and our family. One day, it was April of 2019. I was just la-di-daing around, and I looked at my now husband and I said, "Hey, what do you think about me being a chiropractor?" And he goes, "I think you'd be a good chiropractor." I'm like, me too. Do you think I'd be good at it? And he's like, "I think you'd be great." I'm like, can we do it? And he's like, "I think so." We had a little bit of a little extended income at the time. And I was like, well, I think I'm going to do it. So I applied right then and there to chiropractic school and got in, and I started in that September. But really, the biggest thing was I wanted to have an impact on patients, beyond fighting with someone about playing time or arguing with someone about the proper lifting techniques. I wanted to be able to actually use my manual therapy skills and be able to have more than superficial conversations with my patients. So entered chiropractic.
That's awesome. So I know in the chiropractic world, there's a lot of different type of chiropractors, right? So what kind of separates you from other chiropractors in the area?
That history that I was talking about is the biggest thing. We're at almost 30 years now of working with athletes, whether professional, college, high school, or just our general everyday. I say it all the time, and I don't mean it with any disrespect, but our stay-at-home moms, man, those women are so athletic. They're using their bodies on a daily basis to do their job, to keep other people alive. So I work with athletes, and I'm always have that athlete mindset that no matter what you do, you're an athlete because you use your body to make a living or help other people survive. So that sets me apart. Having the manual therapy skills that I had developed prior to becoming a chiropractor gives me a really good sense on when we do trigger point work. I do muscle work as well as the adjustments. I have a good feel of what that body is. A lot of my patients will tell me that I have magnet fingers because I just know where to go to hit those trigger points to really get the muscles to calm down so that the adjustments go well. And then outside of that is really just my view on you need to have exercise, you need to have chiropractic. You can have one, you can have the other, but the system works so much better when it's both together.
No, absolutely. I totally agree with that. We have a lot of patients who, they might have an injury. They go on Google or YouTube and just look for, exercises, but unfortunately, like it's in the wrong order, or they do something a little too advanced, they might hurt themselves. And we truly believe in the same concept that everybody's an athlete, right? Even though you're not necessarily playing a sport, like if you have to lift, if you have to push something, if you pull something, like those are athletic type of movements, right? So yeah, I definitely agree with that. Do you have an ideal like patient or age group you specifically work with?
I would love to say yes, but the real answer is no, because each one of them are so personally rewarding for me. Do I enjoy? I love working with pregnant moms.
Okay.
Actually, it's pregnant moms. Yes, it's the postpartum mom that's really important. After that 6 weeks, when everyone's kind of forgotten that they exist as their own entity. You know, when they're pregnant, how are you feeling? How are you doing? How are you doing? And then after the baby's born, it's how's the baby? Is the baby growing? Is the baby sleeping? No one asks the mom how they are. So being able to manage their health and be a sounding board, because sometimes it's really hard. And moms don't want to talk about it being hard. And some days kind of suck. There's a many great days, don't get me wrong, but some kind of suck and your body hurts and you haven't slept and you know your partner's working, and so you're left with only this little wonderful human that you created to talk to.
Right.
So being an outlet for those moms, that really like helps my heart a lot. But we're also seeing an influx of patients who are in their 60s and 70s
Okay.
here that are getting chiropractic care. It looks a little different, but we're also able to kind of advance and help their activities of daily living, which helps prolong their life and makes their quality of life better. So that's been really rewarding. So yeah, and then everything in between, man. You've got the dad who's got to keep his family fed, and you've got the mom who's got to keep them alive. And but I really just like the every patient is different approach that we have here.
Yeah, for sure. That's great. Heard good things about how you customize the care to each patient, and I think that's very important because everybody coming in with a knee problem has a different like cause of the problem, so the treatment has to be a little different depending on what's causing the knee problem or whatever they're coming in for, right? So, okay, what is a process to look like for you? Do you have a certain flow at all?
We do. We've got a pretty specific flow. From the time that you call to make an appointment, you get all the necessary information. I work with the two different women. I have one woman who works actually remotely, where if you call, you're going to talk to her. She's going to answer the phone. She's going to get you scheduled. She's probably the sweetest, most wonderful human on the planet. And then when you come in, I've got another wonderful front office young lady who makes sure that all of our paperwork is done, right? We've got either online forms or paper forms, depending on where we are, excuse me, with the portal. We get them set up. She then takes the patients back for a quick tour of the clinic, because that takes a lot of the fear away, like what's coming out of that door, what's that for. We tell them as they go through our clinic what everything is for. We get them into our medical room, and in their medical history, a pretty detailed medical history is taken about current injury and even past injuries, because a lot of patients don't understand that just because you're dealing with something now doesn't mean it started now. And it probably started way back when. So we want a detailed past history as well as current history. Then we do a handoff where we actually, after finding out the true reason the patient's here, a lot of patients will come in because they're in pain.
Yeah.
But what is the reason? And usually it's something like, I can't bend down to pick up my child, or I can't do something like I can't put my socks on. Yeah. Older patients, I have to have my wife put on my socks, right? And that just kind of that makes them feel bad here. So we get to that root cause, like what is the real like reason you need to get here? And then from there, I get to talk to the patients. We do a thorough examination. We do muscle testing. We do nerve testing to make sure that we're not dealing with anything that could be a brain or spinal cord injury. And from there, after the examination, is the x-rays. We do x-rays here on site, which is really exciting for us to be able to do. And from there, currently patients are getting their first adjustment, as long as I can rule out it being a safe thing for them. And I say currently, we may be changing that process here in the near future, just because we may add in services. But and then on the second visit, it's really where the rubber meets the road, where we go over those x-rays with the patient, and the patient and I then do that custom care, like what is important to them, what do we need to do to get them where they need to be.
Right.
And then that's when we like decide on what that true plan of care is. So that's usually the process.
That's awesome. This sounds very comprehensive for sure. And from your standpoint, how do you determine if someone needs chiropractic care or if they don't need chiropractic care?
Oh, I'd love to be like, well, everyone needs chiropractic care. But really, the biggest thing is what we're looking for are those restrictions in the range of motion, restriction in the tests that I do, as well as then we look at that x-ray, and the x-ray really pretty much tells you what you need to do. The restrictions will tell you where their bad movement patterns are. The x-rays help tell us where those structures have some problems. And we can look at if there's any rotations on the x-ray, if there's anything that positionally on that x-ray looks different that we can actually affect with our hands. And if we're able to do that, then that's the patient that gets the chiropractic care.
Awesome. What do you want people to know about chiropractic care before they actually seek chiropractic care?
If they've never had experience with chiropractic care, a lot of the patients, especially in my age group, not so much yours, you're very young, but in my age group, we grew up watching Rambos and Arnold Schwarzeneggers, where there's that the bad guy gets killed by adjusting their neck. Chiropractic is safe. We take the bones to their limit on the tension and then apply a thrust. We're not breaking any bones. We're not breaking any necks or backs. That someone who is trained can take the tissue to that actual physiological limit is what it's called, and create a thrust that isn't dangerous to the patient. And that chiropractors, although in the past have gotten kind of a bad rap for being shysters, really the difference is like we're just here to make sure bodies get better. We want our patients to get better. And I get this a lot from patients. You're not going to hurt me, am I? I'm like, no, it's bad for business if we hurt you.
Right.
So we're educated. We keep up with our continuing education so that we can provide the best care to our patients without that danger sneaking up.
For sure. Sure. Yeah, that's a very common question we get asked all the time. It's like, oh, I know they do adjustments. Is that like gonna break my bones? Is it gonna fracture my bones, or is it even safe? I'm like, yeah, I mean, it's just like any other technique out there. If you apply it, practice it, and learn it properly, and know the red flags, right, of when to do it, when not to do it, like why would it be dangerous? Because there's not one technique that solves everybody's problem. There's always a risk, no matter what, whether it's adjustment, taking a medication, getting an injection, there's always a risk. The question is, what's the risk versus the reward? And that's kind of what we tell our patients.
Yeah.
About adjustments and stuff like that.
Yeah. And that's the other reason we do such a comprehensive examination, is that we can rule out those red flags before we get to it.
For sure. Now, I think that's very important. It's very similar to our process where, patient might call in and say, hey, I need this or that. I'm like, hold on a sec. Let's actually see if you need it or not, right? And that's kind of where the assessment would dictate like, what is the actual intervention. Awesome. What's your thoughts about getting physical therapy combined with chiropractic care?
Necessary, 100%. Like, done with that question. No. We do a form of rehabilitation here. It's not the high intensity physical therapy that you provide, Dr. Jack, but I really don't think you can have one with like succeed without the other.
Yeah.
You've got to get the structures online. You've got to get the muscle tone online. And you've got to address dysfunctional movement patterns. Otherwise, our patients are just going to fall back into those same bad patterns without any mindfulness to it. And when that happens, both of us look bad. Like, oh, I went to physical therapy, it didn't work. Oh, I went to chiropractic, it didn't work. Well, did you do X, Y, and Z? Well, no, why would I? So that it works.
Right.
Yeah.
No, it totally makes sense. You know, we're one of the few clinics from physical therapy side do adjustments as well. But we'll tell the patient, like, hey, if you don't do the habits that keep the adjustments in check, like eventually, like you're gonna lose the benefit of the adjustments of, or kind of what we speak about in office. So that's definitely a lot of education we have to do up front.
Yeah.
And why the home exercise program is so important.
Yep.
Awesome. If there's one main thing you want to be known for, what would it be?
Ultimately, I want to be known for changing healthcare in our area. One thing we haven't been able to talk about because I'm just not there yet is I will be bringing on a nurse practitioner in the next few months. And in doing so, we're able to add services that can truly impact our patients without steroids, without surgery, without dangerous medications. And if I just get to be a small part of bringing that to our area, because it's something we're definitely lacking here in the Lake Houston area, then I'm going to consider myself incredibly fortunate with my life.
That's awesome. You mind elaborating on what you're bringing to the area?
Or yes, I would love to.
Reps? Okay, cool.
Oh, so by bringing in a nurse practitioner, what we're also able to do is offer medical services. That changes the dynamic a little bit in the mindset of our patients, in that every one of us we're all indoctrinated into that medical system right. We learned through 2020 that maybe our doctors don't know everything like we thought that they did, but we're still likely to, like, if we're sick, if we're injured, we're going to seek a medical professional. And for you on your physical therapy and me on my chiropractic side, we're still kind of on the fringe of that. So by bringing in a nurse practitioner, we're able to actually bring in medical services, and a little bit more authority on, like, this is what we need to do to get you better. And in those services, currently we're looking at joint injections being huge for us, whether that's through PRP, through peptides, other services that have been shown to work to really help joints heal. So not only will we have that small rehabilitative piece, we'll have the chiropractic piece. Now we're actually having joint healing piece, can be large. We're also working with a couple different companies for supplements. And one company called New Skin, we're working with them to start kind of helping repair gut health with our patients, because if your gut's not healthy, none of the rest of the body is going to be healthy. You're going to have more inflammation and problems there. We're also partnering with a company called 10X Health, where we are an independent contractor, where we can actually do full-on genetic testing, where we can find out over 54 genes what patients can do to better their health, whether time of exercise, amount of exercise, what foods to eat, what foods not to eat, what supplements to take, what not to take, the whole gamut of information that we can get through 10X Health. And then there is some supplementation that can go along with that as well. And then the big thing would be with that genetic 10X Health, the genetic testing, we'll also be able to offer IV therapy for patients that is specific to their genetic code as well. There's so many wonderful, exciting things that are going to happen here in the next probably 6 months that I look forward to being able to talk to you again to talk about all those great things.
Oh, that's awesome. So you're basically doing like custom planning from the genetic side of things, right?
Yeah.
Yeah. That's definitely a very well needed service. I don't think anybody is doing that in the area. So I'm excited to kind of catch up when that all comes into play.
Well, it's really exciting when we start talking about the ReviveX. Once we're able to get there, there are 2 facilities in the country that offer this like specific IV therapy, and they're both in Las Vegas. One's at the shoot. I'm gonna say it wrong. They're both in Las Vegas.
Okay.
They're not here, so that's going to be completely transform our area.
That's awesome. Cool.
We're here to help make a difference in our community. And if patients have pain, if they have dysfunction, if they just don't feel good, let us see what we can do to try to help improve your situation.
Awesome. And what's the best way to get a hold of you guys?
You can either text or call our office number. It's 281-852-8724. Or check out our website at, it's currently drharrell.com.